Welcome to the Empower Group, a global organization with a mission to transform the way people learn, work, and save lives. We execute our mission by working through 3 centers and organizations: the Center for Leadership and Development, the Center for Digital Learning and Animation, and the Empower School of Health.
To date, we have delivered more than 1 million hours of training in over 100 countries to thousands of students in all the areas of public health, such as disease management, immunization, antimicrobial resistance, supply chain management, regulatory affairs, access to medicines, and so on.
We implement these programs by partnering with organizations which include ministries of health, UN agencies, civil society organizations, and the private sector. We are transforming the approach of capacity building by moving away from expensive classroom-based training and introducing digital and blended learning. We design comprehensive and innovative learning strategies, which include web-based trainings that are built on Empower's open source learning management solution. We design content that is customized to the learner's requirements, including micro-learning and content in local languages. And for more complex topics, we design content using virtual and augmented reality to provide a more immersive learning experience. Another unique feature built into our learning strategy is our adaptive assessment tool, which allows learners and managers to review their growth over time and also compare their outcome with peers in their own organization or even with peers from other countries. Finally, we like to make learning fun, and so we bring elements of animation and games into our content and learning designs.
And with this, we have the ambition of being able to reach much larger numbers of people, reaching all the actors of the primary care system, all the community workers at the last mile. This is how we can help transform systems of health and improve their performance. We have a great team. Among them, former chiefs of states, former ministers of health, former high-level diplomats, specialists in public health, in supply chain, in training, and of course, in information technology.
For more information, please visit our offices in Geneva, New York, New Delhi, Dakar, and Kathmandu. For more information, you can also contact us at www.empoweringmillions.org.
Greetings, my name is Francis Wango. I have had the singular opportunity to interact with Empower School of Health for over 2 decades now. And within this period, I have been opportuned to undertake to completion the postgraduate diploma, and I am now taking the Masters of Science in Global Health Procurement and Supply Chain Management course. Both of these courses have been career-defining moments in my life and in my career. The postgraduate diploma course was at the basis of my transition from a faith-based organization to an international non-governmental and humanitarian organization. The current master's course helped a lot in my evolution from a locally based staff to an internationally based staff. All of these progressions were due to my consistent interaction with Empower and the benefits of its webinars, short courses, and certifications. I have had the singular opportunity to share this knowledge with other mentees and students that have been opportuned to train and to mentor. I want to encourage each and everyone who is looking for quality, innovative, and cost-effective professional education and certification to not hesitate to reach out to Empower School of Health. They are available. Their dynamic team is ever willing and ready and always understanding in circumstances where adaptability is necessary. Please reach out to Empower and be encouraged.
My name is Dr. Abdurrashid Abdejama. I'm a pharmacist manager on the Central Medical Store in Djibouti. The online Master of Global Health Procurement and Supply Chain at Empower School of Health provide me the opportunity to gain new skill and to improve my task, such as how to quantify health products, how to create and quality medical insurance and procedure, and too much area of expertise in global health procurement. I'm thankful for Empower Health School to give me this opportunity. Thank you.
Greetings all. My name is Sonia and I'm from Empower School of Health. We are still left with 3 minutes. I can see people are still joining, so we will wait for a few more minutes and then we will start. Thank you. Thank you all for your patience. So now I think we should start. We are on time right now. As you can see on the screen, I hope my screen is visible to all. And if you have any questions, concern, please put it on the chat. The backend team will resolve your concern. So today's webinar, this is another lined up webinar with Ethiopian Pharmaceutical Association. This is our partner, Empower and EPA. We have partnered, it's been almost a year now, and this is generally on every alternate month. We used to organize a webinar on the most demanded topic. And for today's webinar, the topic is strengthening pharmaceutical system and impact on SDG Health Goals. This webinar will be for 1 hour, and you can see on the screen we have two speakers for today's webinar. Professor Sultan, he is a professor from Jimma University. Professor Andy Baloklam, he is a director, education and capacity building. After participating in the webinar, you will be receiving a certificate for participating in the webinar. The recording will be shared with all of you, and this webinar is live on our official Facebook page. Before moving to next slide, I can see Mr. Kidu. He's a main person with whom we usually coordinate with, and he's a part of EPA. So I really would like to give this floor to Mr. Kidu to say a few words about our partnership, and then we will move on further with the topic. Mr. Kidu, if you are there, please unmute yourself.
Hi, Sonia. Can you hear me?
Yes, we can hear you.
Thank you very much. My name is Kiddu. I'm Kiddu Hailu from the Ethiopian Pharmaceutical Association. I'm serving the association as executive director for many years. This webinar is part of the one activity from the partnership the Ethiopian Pharmaceutical Association is enjoying with Empower School of Health. We have signed an MOU or an agreement last year, and we have been organizing joint webinars. And of course, the Empower School of Health was a co-sponsor or organizer of the 43rd Ethiopian Pharmaceutical Association annual conference organized back in July 2023. So we are really very thankful to Empower School of Health for its key partnership with our association, and I hope this partnership will continue with renewed momentum in the years and months to come. Thank you very much, Sonia.
Thank you, Mr. Kidu. I can see Professor Andy is there, and if you can just coordinate with Professor Sultan, I can see he hasn't joined yet. But not an issue. We will move forward with Professor Andy.
Let me remind him, or can we start with Professor Andy? Is it possible?
Yes, he will be speaking first.
Yeah, let us start with Professor Andy, and then Professor Sultan will come.
And thank you for your kind words, Mr. Kidu. And audience, we will be now proceeding further with the presentations.
Thank you.
Thank you. So this will be the agenda for today's webinar. As I mentioned, there will be two speakers, and both of them will be speaking on the topic above as per their experiences and their skills. So these are a few housekeeping announcements for audience. Please mute your mic and turn off your videos. As I mentioned, you can ask your questions in the chat box, and those will be answered during a Q&A session once both the speakers will complete with their presentation. We will be having two polls, so I would request all of you to please participate in the poll. They are very generic questions. The webinar recording link will be shared with you all post-webinar. These are a few housekeeping announcements for speakers. Please turn on your cameras for better engagement. Please mute your microphone when other speaker is speaking. And since this webinar is for 60 minutes, so please follow the scheduled timings. This is the webinar objective. This study explores the interrelationship amongst the current sustainability agenda of pharmaceutical industry. Based on United Nations Sustainable Development Goals and the element of JEE tool and trade component of One Health approach. Now this is time to launch poll 1. I would request backend team, and I would request all participants to please participate in this poll. You just need to select the respective answer, and at the end, this will be for a few seconds or maximum for a minute, and then we will share the polls with you. So these questions are basically a generic question about your gender, age group, geographical region you are from, your academic background, and about your experience, your sector, your area of work, current organization that you're working with, and how come you know about this webinar. So I can see 35% of participants have participated in the poll. I would request others to please, promptly select the respective answers. So we will move on to further slides, and this will save our time. So that can be utilized in the Q&A session. So now I can see 50%. So 50% is still remaining. As per the current selection that I can see over here, the maximum gender is male, that is 64%. The age group that we have, audience are between 30 to 40 age group. The geographical region I can see over here, Africa and Middle East, that is 53%. The academic background, pharmacy diploma, bachelor's degree. Those are the maximum one that we have for today. And how many years of experience? So most of you have more than 5 years of experience. I'm so sorry. So maximum audience are from which sector? National government, that is 20. No, private sector, that is 33%. And what is the area of work? That is 39% from supply chain. Which type of organization do you work for? That is 32% from hospital and clinical. And maximum of the audience knows about the Empower email that was circulated by the marketing team. Good to know. We will also be keep you all posted about the upcoming webinars also. So now I think this is time to just close this poll and move on to the next poll. Backend team, please close the poll. Thank you. You all can see the results on the screen, and that has been briefly described by me few seconds before. Thank you all for your participation. Now we will move on to next slides. Now I would like to introduce Professor Andy. He's the first speaker for today's webinar, and I would be glad if Professor Andy can briefly describe himself, and so we will move on to his presentation. Professor Andy, over to you.
Okay, greetings to all. I see many of the names will have heard my voice many times already by undertaking the Empower courses, so I don't think we need much introduction other than I'm a very old man. I'm one of the authors of the Yellow Book, which most of you know, Managing Access to Medicines. Over 30 years in healthcare supply chain. I've worked in over 42 countries. And of course, strengthening pharmaceutical systems is one of our main operations. I'm also the author of most of the Empower training courses, including the new master's degree. Okay, let's go to the next slide, please. Okay, we have quite a short time today, so I'm going to speak quite fast. We have just 20 minutes, and I'll try and keep to that time. Next slide, please. I think we've already had that, so next one, please. Okay, Sustainable Development Goals. The point around this is that all the Sustainable Development Goals are interlinked. So when we talk about what is the impact of pharmaceutical strengthening on the Sustainable Development Goals, we shouldn't just think about SDG 3, the health goals. If we improve health, we also reduce poverty. We also have impacts on hunger and on the economic growth of the country because we've improved the overall health. So there's a huge impact, not just on SDG 3, but across all the Sustainable Development Goals. In today's talk, I'm going to focus on SDG 3, the Health Development Goals. But let's understand that impact cuts across all sustainable development. What we do in pharmaceutical strengthening has an impact far beyond the health sector. Next slide, please. Measuring pharmaceutical system strengthening, we have to start by defining it. And on the screen, you'll see a generally accepted definition of what we mean by pharmaceutical system strengthening. And in part 2, Professor Sultan will develop that a little bit more. So I'm going to talk through that quite quickly and go on to the next slide, please. Well, what does it actually involve in this pharmaceutical strengthening? We talk about strengthening the governance. And that's an important part. How we govern, how we operate the whole system. Increasing the human resources, not just the number of people, but their skill levels, their management ability, and the regulation of medical products. Improving pharmaceutical information for decision making. Often when we're deciding, we don't currently have good information. A lot of the time we're guessing. How much do we have? What's the expiry date? We don't know. We're guessing all the time. We have to improve the information we have. Pharmaceutical sector financing, and most of us have got no idea what the actual costs are as we go through the whole pharmaceutical system. Indeed, in many countries, we are prevented from even calculating what the cost. What is the cost of operating the pharmacy? Don't know. We have to change that. Everyone in the private sector knows their cost to 3 decimal places. We have to be able to understand the costs, the financing a lot better, so that we can make informed decisions. Improving pharmaceutical services and particularly product availability. Moving towards a patient-centered care approach, looking at health outcomes. Products are important, but we have to go beyond products to their impact on the health outcomes. That's quite a lot. And that's a complex, because a lot of these are interlinked. We can't improve the governance if we don't have the information. And we can't improve the resources if we don't have the financing. So we have to look at this as an overall approach of total system strengthening. We can't just do a little bit. We can't just do a bit of training and say that's pharmaceutical system strengthening. It isn't. We have to look at the total approach. Next slide, please. Three uncomfortable truths around pharmaceutical system strengthening. Firstly, it's lengthy and resource intensive. It takes a long time and it takes a lot of resources. It's not just like buying more medicine. We can see the impact. When we do system strengthening, it can take years to see the impact. It's a long process, and that doesn't suit everybody. Many of the donors, many of the funding agencies, they want a quick reaction right now. And that's not what system strengthening delivers. It delivers real benefits, but it takes time. The next problem is, how do we measure that we're getting better? The key metrics, the KPI, the key performance indicators. And unfortunately, we don't have a good agreement on how to measure it. We also have far too intense focus around the product, around the medicines. We need to look beyond that to the systems. If the patient doesn't accept the medicine, doesn't take them, we don't have patient compliance, we've failed. So part of pharmaceutical system strengthening is to go beyond just the availability of the product into the total health benefit, the total health impact. And that means counseling and pharmacovigilance and all the other soft aspects of pharmaceutical systems. So it's a complex process. It's difficult to measure and it takes a long time. Those are our three uncomfortable truths around pharmaceutical system strengthening. Next slide, please. Well, what does this mean? It means it takes a long time to measure the impact. Typically, it takes 5 years. I improve the system. I don't actually see that it gets better. The key performance indicators don't deliver the results for quite a long time. There's no global agreement on how to measure it and what to measure. We've got KPI, we've got indicators. We don't have a really good consensus on what to use and what they are. And that lack of consensus means I haven't got a lot of hard evidence. If I'm going to go and advocate, if I'm going to go and fight for funding, for resources, I have to have hard evidence. And I haven't got it. I haven't got it because I'm not measuring it. I'm not measuring it because we don't have a consensus on what to measure. So we're going round in circles here. And we have to try and break this and come forward with pharmaceutical system strengthening and convince donors and financing agencies that it's a critical aspect. Next slide, please. If we look at the detailed Sustainable Development Goals, SDG 3, particularly 3B, talks about access. I'm going to focus on that one word just for now, even though I've said pharmaceutical system strengthening is a lot more. But let's just take access for now. Just trying to define that word access, WHO put together a group of the great and the good, and they produced a list of 100 KPI. That's how you measure access. You need to measure 100 key performance indicators. Well, that was obviously impractical. And after a lot of argument and a lot of debate, they got it down to around 22. Next slide, please. And here on the right are the 22 indicators, just for that one word, access. But I said before we didn't have an agreement, but this is the World Health list. Well, yes, but look on the left. The regions didn't all agree it. Africa had its response, the Americas were different, Europe had its own ideas, Southeast Asia said we're going to do our own thing, and the Western Pacific did something completely different. So even though we have this list of 22 KPI, we don't have a really good agreement around it. But that should not stop us starting to measure all of these KPI. It's not just about pharmaceutical system strengthening. We should have these KPI anyway. How can we possibly know what we're doing if we don't have these key performance indicators? We don't have to wait for a global agreement. We can start measuring them, and we should start measuring them now. Next slide, please. Well, how are we doing on measuring these indicators? Well, this is the WHO monitoring report, and you can see there the big red arrow going to 3B number 1, access to medicines. Data available, very poor. Disaggregated data, very poor. Estimates, not available. We haven't got anything. How can I go to donors and argue and advocate to spend money on pharmaceutical system strengthening when I don't have good evidence? I don't have good evidence because we're not measuring the KPI. We're not collecting that data. And that's a situation which has to change. We all want to improve pharmaceutical systems. To do that, we need to be able to advocate and get the resources. We have to start collecting the data. Next slide, please. We weren't doing good before COVID hit, and then COVID hit and made it all a lot worse. We've seen everything. All of the few indicators, all of the little bit of data we've got going backwards. We looked at fill rates before COVID, getting up to nearly 90%. Whatever district clinics requested, we could fulfill 90% of the orders. COVID hit, now we're down at 45, 50%. And we've improved after COVID, but not all that much. We're not back to where we were before. We have to do a lot more to move back and recover the ground we lost during COVID. Next slide, please. What does it mean? Well, we didn't have a lot of data before COVID, and now COVID's hit and made it all a bit worse. We have to try and put this together and start measuring. So we have to recognize that currently we don't have a lot of hard evidence in low and middle income countries to support the direct impact of pharmaceutical system strengthening. We all want it. We're sure it's all good. Can we prove it actually improves the overall health of the country? And right now, that's difficult. Next slide, please. But what we have in our favor is the counter argument. What happens if we do not strengthen pharmaceutical systems? If we look at the situation now, we have people estimating if we just delivered the medicines we've got now, we know, of course, we want more medicine. We want a lot more support. We want a lot more funding. But if we just got the medicines we have now to the patients, and the patients accepted and had compliance, we could reduce 6 million deaths. Just doing what we've already got. Some people estimate 10 million deaths could be saved. So we have to improve our pharmaceutical systems. We're not performing. The supply chain's not performing that well, and the dispensing is not performing that well because we're not counselling and the patients are not accepting and have compliance and adherence to the treatment regimens. We have lots of evidence that when we have stockouts, we get increased deaths. They don't drop dead immediately at the dispensing window. It often takes 6 months or a year, but it increases the death rates. And this disconnect, this long time between activity and impact is a problem because everybody wants immediate. We don't have immediate. The impact is over the longer term. So we improve the pharmaceutical system, we reduce the number of deaths, we improve the healthcare, but it's a longer term impact. And that's difficult to advocate for. Next slide, please. But we have some powerful friends. This is the Asian Development Bank. And they've said, we know pharmaceutical systems has a major impact. They transform public health. They really bring lots of benefits. And there are major policy papers issued by ADB describing in detail how we have to strengthen supply chain and pharmaceutical systems. We can't transform public health. We can never achieve the Sustainable Development Goals if we don't make those investments in pharmaceutical systems. Next slide, please. And some countries have already started. This is a dashboard from Uganda. And you can see the scores, you can see medicines availability, you can see progress on indicators, you can see timeliness of orders. They're starting to measure the KPI. They're using electronic systems and IT to help develop that, to start put that together. And as we build that database, we build evidence. And as we build evidence, we have ammunition to advocate, to demand more resources, to demand funding for pharmaceutical systems. It's important that we put those systems in. It's important that we start measuring those KPI because that enables us to advocate for the resources and funding to strengthen pharmaceutical systems. Next slide, please. And pharmaceutical system strengthening is occurring. There's a list here of all the countries where it's going on now, where it's happening. And yes, Ethiopia is included in there, as you can see. I'm sure we'll have some in the Q&A about just what's happening in Ethiopia. Strengthening leadership and management in South Africa, empowering communities in India, all across the board. So pharmaceutical systems is the total approach. Yes, supply chain is part of it, but so is patient interaction. It's the whole operation of pharmaceutical systems. It's happening. It's going forward. And as it goes forward, we collect the data, we get more evidence to prove the case of the need for strengthening pharmaceutical systems. Next slide, please. And here is a more detailed example from Namibia. The dashboard for data flow showing how they're starting to measure all the different components, the laws and governance, regulatory systems, human resources, financing, information, all the way through. As we start to gather the data, then we can interact, we can take informed decisions, and we can advocate for ever greater funding and resources to drive it forward. Without that, it's difficult. We all believe in pharmaceutical systems, but we have to bring the evidence to prove it. And the evidence is gaining. It's there. It does impact. It's for certain. We can never achieve the Sustainable Development Goals if we don't strengthen pharmaceutical systems. Next slide, please. An example from Nepal, and they openly say, we don't understand why we have access problems. We don't understand why we got all these medicines and we're not getting it to the patient. We don't understand what's going wrong. And that's often the case. In Nepal, the WHO target is for 80% availability of essential medicines. They only make about 60%. They only manage to achieve about 60%. They don't know because we don't have the data. We haven't collected the KPIs. Once we've got the KPIs, we can see where the problem is. We can address the shortfalls and the difficulties in the system. It's a particular factor for children's medicines, the Essential Medicines Children's List. We're seeing lots of shortages worldwide in children's formulations. So we have to be able to improve and react to those as well. Next slide, please. If you want to learn more about strengthening pharmaceutical systems, there is a free online course, and you do get a certificate. The link is on the screen. It's in 10 modules. Takes around about 2 hours, a little bit more perhaps to complete. It's relatively straightforward. It's just an introduction to the concept of pharmaceutical system strengthening, how you go about it, how you measure it, how it can work together with you. If you're interested, just follow the link on the screen. You will receive the slide deck. You will also have the Facebook recording of the webinars, so it's easy to follow. Or take a screenshot now and go to the link, and you can get a free course on pharmaceutical system strengthening introduction. It's the 101 course. Next slide, please. My overall message: we have to achieve pharmaceutical system strengthening. We cannot ever achieve the Sustainable Development Goals if we don't have pharmaceutical strengthening. And that means total system strengthening, not just buying a bit more medicine. We have to have a total systems approach, look all the way through it: policies, laws, governance, regulatory systems, financing, human resources, information, the whole system. We have to take it as a complete system and look at strengthening. Regrettably, despite my 30 years of campaigning and advocating, the value and critical role of pharmaceutical system strengthening is still not widely recognized. We have to measure the impact. We have to have these KPIs. Does need a long-term approach, so we have to start doing it now. Measure the KPIs, measuring the access to medicines. You don't have to wait for it, but we should, all of you, every one of you, should be advocating for pharmaceutical system strengthening, should be promoting that. Did they teach you this at pharmacy school? Almost certainly not. But you have a free course we've just given you where you can look at that and gain extra information about it. Lives depend on it. We could do much better with the medicines we've already got if we can strengthen our pharmaceutical systems. It's imperative, it's critical, and it's life-saving. Okay, that's my presentation. Thank you. I can hand over to Prof. Sultan Suleiman.
Thank you, Professor Andy, for your presentation. I can see on the chat box there are 2 questions that has been asked by the attendees. So I would request you in the meantime, you can just have a look and we'll just move on to the Professor Sultan presentation now.
Okay, my question is,
in the meantime,
okay.
just I'll take 1 minute. As you can see on 2 to 3 slides, these slide deck will be shared since we have a short time. So I'll just briefly take you all through these slides. So as mentioned, and in continuation to Professor Andy's presentation, Empower School of Health have many courses that is basically on supply chain and relevant, relevant facts about it. So I would request you all to please visit our website for those. If you are interested for any of the courses, majorly for the PGD and Masters, we have partial scholarship. Those will be awarded to the attendees who have attended today's session. So please visit our website. The slide deck will be shared with you all, and you can fill up your application form. The relevant team will get connected with you. The upcoming session that we have for all our courses, that is for this month, and it is starting from 25th of November this month. Now, Professor Andy, over to you if you would like to acknowledge those questions just now.
Okay, I see two. One is around NRA, which is National Regulatory Authority, to improve cooperation. Yes, it's essential. Regulatory authorities are part of pharmaceutical system strengthening. That needs to happen as well. There are various initiatives going on. Regrettably, they're not making a lot of progress presently, but we hope now that COVID is over, they're going to take off again and come together. But NRAs are a key component of pharmaceutical system strengthening. One is, are the Sustainable Development Goals related to pharmaceutical system strengthening going in the right direction? And the answer is yes, but they've had a setback for COVID. They're now starting to recover from COVID, not quite back to pre-COVID levels, but close to that at present. I see Prof. Sultan is available now, so maybe I can hand over to him to keep the time flowing along.
Thank you, Professor Andy. So now I would like to give floor to Professor Sultan from Jimma University. Professor, if you can just briefly introduce yourself to the audience, and we will move forward with your slides. Thank you.
Hello. Hello.
Yes, Mr. Sultan, we can hear you.
Yeah.
Thank you.
Just I do have a sort of connection problem as I am in the field. Anyway, there could be some interruptions. Sorry for that. And I am a professor from Jimma University, and now working as a visiting scholar at Camry Medical Research Institute, and now I'm coming back to Ethiopia very recently, and now working at Jimma University now. And you can introduce me if you like, I think.
Yeah, so Professor Sultan has already introduced himself. He's currently a professor at Jimma University, and he is a pharmacy graduate pharmacist by profession, holds a PhD degree in pharmaceutical science from University of Ghent, Belgium, in February 2016. He has published more than 50 articles on both local and international peer-reviewed journals, and has developed and reviewed various curriculum for both undergraduate and postgraduate pharmacy academy programs. And he has established a state-of-art quality control, quality assurance laboratory entitled by Jimma University Laboratory of Drug Quality, which contributes to improve access to quality assured medicine in Ethiopia. So now we will move forward to Professor Sultan presentation.
Can I share my slide?
Professor, I'm sharing it. If you can see it.
Okay. Just to go with in the introduction section, there is one correction. I do have more than 85 publications nowadays, and you used the old version of the biography. So correct that to more than 85 articles.
No,
Thank you. Having said that, I will go to the presentation. Of course, majority of the presentation has been covered by the previous Professor Andy. And the overview of my presentation will be introduction, definition of pharmaceutical system, definition of pharmaceutical system strengthening, components of measurement for pharmaceutical system strengthening, core themes of PSS, access to pharmaceuticals, key messages which could be delivered from what we could discuss. Why do we need pharmaceutical system strengthening? Usually, as we are from low and middle income countries, there are three structural shifts we are witnessing. One is we have been dependent on development from donors. Now we need to have our own implication of domestic resource utilization, from donor assistance to self-development. The second is epidemiological transition from communicable to non-communicable diseases. Especially previously, we have been dealing with infectious diseases. Now, which are coming to existence is the non-communicable diseases like hypertension, diabetes, and the like. And the third shift is reorganization of national health system in alliance with universal health coverage goals as expressed in target 3.8 of the Sustainable Development Goal, which says achieve universal health coverage, access to quality health care services, and access to safe, effective, quality, and affordable essential medicines and vaccines. Next slide. And to respond to these transitions in the developing middle and the middle income and developing countries, the response has been based on donors. And it was successful, but that success is only because of donor reliance, like Global Fund, PEPFAR, and the like. But this cannot be sustainable because of some political alignments. Those donors could not be sustainably health supporting. Because of development corridors, the self-reliance should come into existence. And so this unsustainability in the absence of donors and insufficiency of tracking the challenges needs to have a self-reliant pharmaceutical system strengthening. That means we should depend on our own domestic resources and strengthening what we do have. And thus, we need to keep up pharmaceutical system strengthening health in parallel to
Professor Sultan, I think we have disconnected with you. Can you turn off your camera and then maybe you will be able to, your connectivity will be fine. Yeah, he actually left. I think he's facing some internet issue right now.
Okay, do you want me to try and present the slides until he returns?
Yes, Prof, please take it over.
Okay. So we've got the main message that we've been focusing on communicable diseases, and the big drive has been around donor support, particularly around HIV, TB, malaria. But we're seeing a transition now away from communicable diseases into non-communicable diseases. And the point about the non-communicable diseases is their lifetime long treatments. So that requires a different approach. So we have to revitalize our pharmaceutical systems to adapt into greater volumes of lifetime treatments. Next slide, please. So what is a pharmaceutical system? And we have a general consensus on what we mean by that. Should be a subsystem within the broader health system. What do we mean by system strengthening? Building resilience. Everyone talks about COVID. When COVID hit, we were not resilient. The slightest disruption and the system collapsed. We have to have a resilience so that we can respond, even in times of pandemic, epidemic, and natural disasters. Building the strength, the self-reliance to be able to go forward. That's a major point around that. Okay, back to Prof. Sultan.
So, sorry for the interruption. Sorry. Thank you, Professor Andy. Just to continue, could you hear me now? Yes.
Yes.
Okay, thank you. Just we do have why we need this pharmaceutical system strengthening. I've been talking about that. That is just for the sake of self-reliance on the domestic resources and independent of donors, especially, so that if systems are strengthened from the domestic side, then sustainability of resilience to the challenges will be there, and that is only perceived through individual domestic system strengthening, and that from that pharmaceutical system strengthening, that the one. And when we go to the definitions, what the pharmaceutical system, and the definition incorporates the recurring theme that the pharmaceutical system should be treated as a subsystem within the broader health system, and it provides a strong foundation for measuring the performance of the pharmaceutical system. And pharmaceutical system strengthening is including building resilience and the need to distinguish systems as strengthening from the interventions that rely on continued external inputs to sustain improved performance. There is what we call in a system, what we call a quality shall be built into a process, into a system, than depending on the outcome. So if we can build an outcome as a system in a quality way, so that we can achieve the outcome of a quality, a performance that can be effective, a process that is efficient, and a system that is reliant, self-reliant, and a system that is resilient. So this pharmaceutical system and the pharmaceutical system strengthening can be seen in terms of building resilience by utilizing the domestic self-reliance as a system. Next slide, please. Okay, when we come to the pharmaceutical system definition, MSH, Management Science for Health, proposed the best definition as a pharmaceutical system. And a pharmaceutical system consists of all structures, people, resources, processes, and their interactions within the broader health system that aim to ensure equitable and timely access to safe, effective, quality pharmaceutical products and related services to improve health outcomes. This is what I've been saying. So in order to govern improved health outcome, the system should be of quality, including the human resource, including the service delivery, including the information, including the governance, including the financing, including everything should come up with, at the end, leading to access and availability to affordable, safe, and quality medicines throughout the following the universal health coverage of the United States, the United Nations Sustainable Development Goal. Next slide, please. And when we consider the same for pharmaceutical system strengthening, that is the process of identifying and implementing strategies and actions that achieve coordinated and sustainable improvements in the critical components of a pharmaceutical system to make it more resilient and to enhance its performance for achieving health outcomes. Especially, we should consider what is required from the government, what is required from the policy analysis, what is required from us as a service delivery system, what is required in the human resource delivery system, deployment, employment, financing as a resource, budgeting, pricing, information, to the providers as well as to the community. This all cycle of system should be strengthened as the pharmaceutical system includes all the components, and strengthening all the components in a measurable way to provide at the end the community with full access to affordable, safe and quality medicines is the target. This definition has been given by management science, strengthening pharmaceutical systems, especially MSH SAPS, USAID pharmaceutical system strengthening definition. I've taken the definition from that, and the manuscript on policy and practice, which have been presented by Professor Andy, also indicates the same, citing MSH SAPS for the definition of system strengthening, pharmaceutical system strengthening. Next slide, please. Next slide. Okay. Components for the pharmaceutical system strengthening measurement, especially 7 pharmaceutical system components are critical for guiding measurement of pharmaceutical system strengthening, like pharmaceutical product related services, policy, laws and governance, regulatory systems, human resource, financing, information, innovation, research and development, manufacturing, and trade. These are normally the components that we need to strengthen as a component, independent of each other, or can be dependent on each other, because there are interdependent components as well and independent components as well. So if we are self-reliant on each of the 7 components, so hopefully we can achieve the pharmaceutical strengthening as a system in order to have improved access to quality, effective, and affordable medicines and vaccines throughout the community, throughout the healthcare system. Next slide, please. Next slide. What we mean by component as a pharmaceutical product and related services component. This component is the center of the system, because at the end, we need to give access to affordable, safe, and efficacious medicines to the community, and there should be effective utilization of those resources, and this encompasses anything new. This encompasses the
Professor Sultan, if you can unmute yourself, please. You also muted yourself.
All right, okay. Okay. It encompasses functions of selection, procurement, and distribution of pharmaceutical products. In a properly functioning system, selection is informed by health system, especially it guides to procurement, distribution of essential medicine and products, and a suite of patient-centered service delivery strategies, the strengthening interventions targets, appropriate and cost-effective prescribing, dispensing practice, as well as correct use of pharmaceutical products by the end user can be seen. Especially in Ethiopia, nowadays we are revising the pharmaceutical, the medicine policy, and the medicine and the medical devices policy. And in addition to the 7 components, we are making revisions on the 11 policy directions of pharmaceutical policy of Ethiopia, which has been very old, outdated in 1993. And now we are revising by incorporating such pharmaceutical system strengthening systems into all the policy documents, including the pharmaceutical product related services, the information system. Next slide, please. Next slide. Okay, in the policy, as I've told you, the policy, laws, governance, and regulatory system is one component of the pharmaceutical system strengthening. And of course, this is, we can say it is a hub of doing everything in the entire pharmaceutical system strengthening and directly interacts with all system components. For example, I've been telling that in Ethiopia, we are revising the national medicine and the medical devices policy, which has been outdated it has been introduced in the transitional government of Ethiopia in 1993, and because of different technological development, advancements in science and technology, we are revising the policy now. The policy revision includes 11 policy issues, which includes the quality assurance, the regulatory system, the medicinal products, the information system, the manufacturing, the research, innovation, and the technology transfer, and the like. So this is the hub of the coordination of the entire pharmaceutical system strengthening. That is why we say, and it does have direct interaction with all system components of the pharmaceutical system strengthening. It provides framework, structures, and systems of organizing, financing, and regulating the system, and the coordinating activities of the various institutions and stakeholders to achieve the system objectives. A related component known as the regulatory system focusing on ensuring the safety, efficacy, and the quality of pharmaceutical products and related services, which includes product registration, licensing of pharmaceutical establishment and personnel, inspection and enforcement, surveillance of product quality, safety, regulation and oversight of clinical trials, and control of pharmaceutical product marketing practices, which are usually the regulatory functions which we could see in any national regulatory authorities as regulatory function components. Next slide, please. The other major components, innovation, research, development, and manufacturing and trade. Again, this component addresses all system components. Human resource, research and innovation is important. Manufacturing, research and innovation is important. Trade, partnership, research and innovation is important. So this component is the entry point for pharmaceutical product into the system, and it covers the whole product life cycle, starting from innovation, incubation, commercialization, and then to manufacturing, and then through the manufacturing cycle to the supply entry, then the supply distribution channel, from the distribution to the health facility, from the health facility to the consumer. So it covers the whole product life cycle. And so it started from the entry point of the pharmaceutical product into the system to the end user, the community. So intellectual innovation includes the development of both products and the delivery system. Intellectual property protections in national legislation, international trade agreements shape innovation and trade that and affect the availability and affordability of pharmaceutical products. And this also refers to domestic manufacturing capacity building, where economically viable to produce quality assured and competitively priced generics, and to the research and development of new pharmaceutical products. As I said, in the policy dimension, in the policy review, we have introduced a policy which calls innovation, pharmaceutical innovation, research, development, and technology transfer. And there we introduced a system of governing the development of pharmaceutical manufacturing institutes, the development of pharmaceutical research and development institutes, and the like, and incubation center development, and incentive mechanism for researchers involving pharmaceuticals and vaccines and the like. And so if we are introducing such system strengthening mechanisms, hopefully we can govern a self-reliant pharmaceutical research, innovation, and manufacturing and international trade that can produce an improved access to a quality, assured, affordable, safe, and effective pharmaceuticals, including vaccines. Normally, there are some initiatives in Ethiopia which are including industrial development, Clinton Industrial Park development, for example. It's a dedicated industrial park which is dedicated to pharmaceuticals, and there is, from regulatory point of view, there is incapacitating of the national regulatory authority. For example, AFD, Ethiopian Food and Drug Authority, is going to be strengthened to a maturity level of level 3, so that it can accommodate all the regulatory functions that are in relation with international and World Health Organization standards. And manufacturing sector, the research sector, the supply sector, the medicine information sector is going to be strengthened through self-reliant, domestic, homegrown economic reform initiatives, which have been devised by the current government of Ethiopia. Next slide, please. And the other major components, which seem administrative, but which are very critical, is the financing component. So this refers to the management of resources to ensure adequate and sustainable financing of pharmaceutical product purchases, related services, human resource, and other costs associated with system functioning. It also involves financial risk protection strategies and monitoring and controlling costs and prices to reduce financial barriers to access pharmaceutical products and related services and promote affordability at the system and individual level. If we consider Ethiopian case again, there is a tax reduction on pharmaceutical commodities. So LDC systems or local pharmaceutical to strengthen local pharmaceutical production. If importation of pharmaceuticals and APIs is again at reduced cost around, I think, 10% and 3% for financing, insurance. So together we are expecting around 13% tax reduction to 13%. And these are all financial risk protections, which are being given by the government. And in our policy dimension, as much reduction in tax incurred on pharmaceuticals is going to be requested. And if that has been endorsed, that is going to be endorsed, that will be again a system of protecting the financial risks for those stakeholders involving in pharmaceutical transactions in order to improve access to affordable quality and safe, effective medicines throughout the pharmaceutical supply chain. Human resource component. This ensures again the availability of adequate numbers of appropriately trained staff for managing the supply and the delivery of pharmaceutical products and related services. It includes policy and strategy and the personnel management and development. We do have a good human resource development strategies, but still we do have, as Ethiopian government, we do have some sort of gaps in human resource development strategies for pharmaceutical services, and the training, like possibility of including pharmaceutical doctor of pharmacy trainings in the curriculum of universities and higher educations in Ethiopia, like affiliated and the tailored means of trainings, especially those human resources which are required for the strengthened local pharmaceutical manufacturing practice, like training at the master level, industrial pharmacy training at the master level, at the postgraduate certificate level, and the like. And especially, again, in order to improve the supply, there should be a sort of dedicated training systems at master certificates for the logistics and the supply chain system. Clinical pharmacy training for the hospital, clinical pharmacy services. So tailored to every activity, every functions of the pharmaceutical services that are incurring in Ethiopia, we need to develop our own strategy and adequately produce the required number as well as the deployment of those trained human resources throughout the higher education and the universities in Ethiopia. And the same, what we are seeking is just the scope of practice and the career development. This should also be established at the Ministry of Health and all stakeholders that are governing and utilizing the human resource development of the pharmaceutical service and the healthcare development. The other important is the information component, which is usually referring to generation and dissemination of timely and reliable information to support decision making. So there should be adequate selection, dissemination, generation, and dissemination of relevant, true, and very trustable information, those which are required to inform decision makers. And such information are very essential components of the pharmaceutical system. From the 7 components, this one can also be deterring all the components, and as a form of our policy issues of the 11 policy issues addressed in our revision of the medicine and the medical devices policy, we have introduced the medicine information as one policy issue that can govern all the components of the other policy issues. Next slide, please. Why the objectives of, or the themes, or all the goals of this pharmaceutical system strengthening and what I've been discussing all are to improve access to and the use of pharmaceuticals, and those improved access and the use, especially when we say access to affordable, access to safe, access to effective, access to quality medicine. Of course, sometimes we can say quality could include all. Access to quality pharmaceuticals, if we say that quality pharmaceutical could be safe, effective, and the utilization, rational use of medicine would also be the other. But the overall goal is the pharmaceutical system strengthening is to improve access to affordable, safe, effective, and high quality medicines. And the practice should also be safeguarding the public. It should protect from unethical use of medicines, like there should be rational use of medicines, and the system should be reliant and improvements should be sustainable. So overall objective, overall goal is to have a self-reliant, improved, sustainable access to affordable, safe, effective, and high-quality medicines throughout the supply chain, throughout the product life cycle, throughout the service life cycle to the community. And that should also be accommodated by very rational use of medicines throughout the service provision. Next slide, please. So what we have been, this has been presented by Professor Andy. And so the strategies to increase access is education, for example, awareness creation, patient consultation, and public awareness especially. And so management, business, financial, just what I've discussed previously as the 7 components. These are usually throughout the product life cycle, from the system to provider to the end user. The cycle goes in that, and the strategies are education, management, regulation, and economic contributions should also be given due attention, especially. The next slide, please. So the key message is what I've said, of course. Pharmaceutical system strengthening approach use a health system perspective to better understand the interconnections and dynamics within the pharmaceutical system and other health system components, from strengthening pharmaceutical registration, regulation, and policies to support community case management and patient-centered pharmaceutical care. Stronger pharmaceutical system not only enable supply chains to be more effective, but also pave the way for good governance, equitable access, financial protection, and responsible use of medicines. Next slide. It's a continuation of the key message. By working with countries to strengthen critical element of health system component, pharmaceutical system strengthening approach aim to sustainably improve pharmaceutical system performance, increase access to quality assured, safe, and effective pharmaceutical services that ensure their appropriate use, support progress towards universal health coverage and disease-specific targets, ultimately contribute to achieving and sustaining positive health outcomes and impact. Especially, my acknowledgement goes to message helps, especially the US. They worked specifically on this pharmaceutical system strengthening, not only in Ethiopia, of course, in Africa, and that has been presented by Professor Andy, and it has been shown there. And a number of system improvements, performance improvements, a number of rational use of medicines, a number of regulatory improvements, especially towards achieving maturity level 3, a number of local manufacturing strengthening strategies have been achieved in Ethiopia. And the same is true with African countries, I can witness. And these are the key messages that we can deliver from today's presentation. Next, maybe. Really, thank you for just resiliently listening at me in respective of the technological failures like the connection failure. I want to acknowledge Ethiopian Pharmaceutical Association. I want to acknowledge Empower, the School of Health, and I want to acknowledge all the Ethiopian Pharmaceutical Association members and the audiences. I see about 145 audiences who are participating now on this online webinar. Thank you very much. Thank you.
Thank you, Professor Sultan, for your presentation. So now we will quickly, I can see there are not much questions related to the presentation. If anybody is having any question, I can see there is one question. Thank you for the presentation, Professor Sultan. It's very instructive. Please, is there any LMIC that has successfully implemented pharmaceutical system strengthening? So if so, any lesson learned? So if you would like to just answer this.
Maybe the question again. Sorry.
Yeah, no problem. So the question is, please, is there any LMIC that has successfully implemented pharmaceutical system strengthening? If so, any lesson?
Yeah, just in Ethiopia, we do have a very robust LMIS system implemented by Ethiopian Pharmaceutical Supplies Service, the previous IPSA, Ethiopian Pharmaceutical Supplies Agency. Now currently it's called Ethiopian Pharmaceutical Supplies Service, and a very robust LMIS system has been implemented, and that has reduced wastage of pharmaceuticals and efficient distribution of pharmaceuticals to the delivery system, especially to the health facilities, and it reduced wastage in terms of financial risks. It reduced in terms of pharmaceutical wastage. It reduced in terms of costs, necessarily reducing expiry of drugs. And so the system has been introduced very recently, and now we are witnessing a number of effectively being implemented LMI systems within the supply system. The supply system introduced by the Ethiopian Pharmaceutical Supplies Service at the Federal Ministry of Health. And from there, I can witness that if we do have effective and resilient, robust type of LMI system, we can have effective, safe, affordable medicines being accessible to each component of the health system, health service, at the health facility, at the community, in a very reasonable short period of time, and without affecting the quality of the medicines, and the transportation, the distribution system can easily be accommodated through the implementation of the effective LMI system. Maybe if I have answered it, I don't know.
Thank you, Professor, for the answer. Now, since we are already over time, this is time to launch poll 2. And I can see there are many questions related to the recording certificate. Everything will be provided to you on email post-webinar with the link of this this webinar plus the link to download your certificate. So, and I am really regret to inform you all that we would not be able to share the slides due to the some terms and condition, because and for the privacy of the content. So anyways, you have the recording link. You can take whatever content you would like to take it from the recording. So now I would request backend team to please launch poll 2, and then we will move forward with the closing of the webinar. Thank you all. So again, there are very generic questions. Basically, this is a feedback poll. Was this information useful? You just need to select yes, no. Are you interested in exploring any supply chain courses? Yes, no again. Which course? Because we have provided few categories of the courses. You can select any one of them, because we are about to launch few more new courses. So as per your feedback, it will help us to decide on which type of course and training are you interested in. Are you interested in new career opportunities, supply chain? So it won't take more than a few seconds of yours. Please participate in the last poll, and then we will close this webinar. Thank you all for your presence for today. As informed to you all, the certificate link and the recording link will be shared with you post-webinar within 24 to 48 hours. For any questions, queries related to course enrollment and about Empower School of Health and our partnership with EPA, you can get connected with us by visiting our website. You just need to go to the contact us, or you can write to me at operations@empowerschoolofhealth.org. Thank you all. So I can see 48% of the attendees have participated. We still have half of the audience. I would request you all to please participate. I'll just briefly give you the overview of the results that we were having right now. Was this information useful? I can see 97% says yes. Are you interested in exploring any supply chain courses? 99% says yes. So as informed to you, please visit our website for that. Which courses? I can see SDG Health 12%, maximum are for pharmaceutical management. So we have a course on this topic. The link has already been posted on the chat, or you can visit the Power School of Health website. Online certificate course. So we have more than 10 plus short-term courses with us, which are from 2 to 3 months. So you can visit the website and select whatever course you would like to take on. Are you interested in new career opportunity, supply chain? Yes, looking to grow within my organization. So the courses which we have, generally people, it helps them with their current, because most of our students are professionals, working professionals from health profession, and after along with their professional life they can also do the courses. So for more information, please contact us. So it's time to close the poll, and thank you all for your presence. Special thanks to for both of the speakers, and special thanks for EPA, our partner. For more upcoming webinars, I would request you all to please visit our social media platform, and the link has been posted on the chat box. Thank you.